Welcome to Planetary Health First, Mars Next. We got my good buddy Doug Sullivan here tonight, and I think all of us that got familiar and comfortable online or was in those communities in Clubhouse, and that's how Doug and I met. We have yet to meet each other in person. I feel pretty comfortable that he is a real person, and he doesn't have I would say, I don't know, avatar or something or a digital hologram. But anyway, tonight is going to be exciting. Doug has been a case manager RN for over 20 years. He's worked at some of the best health plans, one of which is Scan Health Plan, which has been for the last 6 years in a row, 4.5 star ratings. And so how do they get that is because they hit all those marks on HEDIS measures, quality indicators, and that's way more than I can share because Doug knows all this. But the purpose of tonight is to be talking about the digital care manager. And I also want to just let you know a little bit about Planetary Health First, Mars Next, and what we're trying to do. We're just trying to accelerate just conversations in healthcare across the board. We do not want to be really highly focused. There's too many things in healthcare that we need to have perspective. And that's why I'm excited that we're having Doug here tonight. He's got a great background. And Doug, will you just introduce yourself briefly to the audience?
Yeah, thanks, Michael. And yeah, Michael hit it on the nose. We met over the COVID times, I guess we can call it. And everybody was jumping on Clubhouse, and that was the way we attended conferences because we couldn't go in person, and we were meeting and greeting each other there and staying with all these typical healthcare conferences that we would probably be attending in person, but we were doing them daily and kind of meeting people by the water cooler, if you will, virtually on Clubhouse and talking about different topics. And so this got us to, learn a lot of things. I've been in healthcare for over 20 years, been a registered nurse and a certified case manager. But I started off in quality, and I started off with Molina Health Plan, actually before Molina, with one of the first IPAs in the country, now it's called Apollo Medical Holdings, but at the time it was called Allied Physicians of California. And learned about managed care when it was a bad word. I remember people would say, "Oh, HMO, I don't want HMO," and doctors rejected the whole thought of an HMO is just creating barriers. And now we have 50% of the country on some type of managed care program, whether it's an HMO or PPO. So we've taken that transition that we learned that things were available with telehealth, and now we're transitioning that into other remote programs. But a lot of these programs were done behind the scenes with companies that I worked for prior to COVID, and we'll go into that a little bit. But this is great that you have this outlet, Michael, and you're taking it to Mars Next. I think we do need to, think about things that we could do better here on Earth when it comes to healthcare. And I know that's your underlying drive here, and you're very passionate about that.
Yeah, no, absolutely. Thanks, Doug. Tell me, what are you working on right now, Doug? I know you do a lot of consulting. Just tell us a little bit, some projects you're working on in this space.
Okay, well, we have a lot of balls in the air, put it that way. So what we do, we've been, the doctor I work with, we started a practice right before COVID hit. And we started our practice to, we were introduced to all these technologies that were done with remote patient monitoring, whether it was a blood pressure device that was cellular or Bluetooth, pulse ox, weight scale, and everything like that. And we thought, why not team up with a group of, they were a group of assisted living type facilities where they were boarding cares. I don't know, but this wasn't just one location. This was several locations. So having everything in the cloud was a necessity. It wasn't inside one facility. And so we linked up them with the technology companies that have been reaching out to us and said, let's test this out in a controlled environment. Let's have every one of those patients be tested with these devices twice a day. So they would get their blood pressure, their pulse ox, their weight was usually done once a week, unless it was like a CHF patient. And let's get all these devices into the cloud and onto this dashboard where we can look at that, and then we can consult with the administrators at those facilities, along with the providers that some of them were mobile providers, or some of them just saw those patients with telehealth. So since we had started on this prior to the pandemic, that really gave us the advantage. So when the pandemic took off, we had we already had the systems in place. And so then telehealth started kicking in. Everybody wanted to do telehealth. We said, it's easy. You don't have to take this patient from that facility to your office. We can just do a telehealth through our iPad. And it wasn't an iPad, it was a tablet. And we were doing telehealth visits for all those patients with all their different doctors. We had it all set up and ready to go. And it worked out really well. As a matter of fact, when we were audited, or when those facilities were audited by the state says they were auditing every positive case of COVID, if you guys remember how they did that.
And hey, Doug, I just want to take a second. We have an audience member.
Okay.
Believe it or not, she's not going to be able to stay the whole time, but this is Mary, and she's like right up your world. She's actually, it looks like she's in Washington State, or and she's has 10 advisors that's relocated seniors from hospitals to SNFs. So I thought that was interesting. And I imagined she might be using some of these technologies, tools to help them, manage their care. If they were at the hospital, and now they're able to possibly, I don't know if they're doing some of that hospital at home, some of those things. Maybe
well, it's not really. I mean, we don't know. It's a hit or miss whether they're doing hospital at home. But let's face the facts. Once a person gets into the hospital, they're pretty critically ill. Hospitals don't let you get admitted for minor things anymore because of our barriers with the insurance benefits and them wanting to only admit the serious cases. And so by the time that person hits that hospital bedroom, they have probably multiple chronic conditions. Those multiple chronic conditions may or may not have been part of a regular treatment program, and they may or not have been part of a case management program. And so what a lot of companies are recognizing is this technology can be used for that transition. You could introduce it into the hospital. You could show them how it works on their smartphone, or how that blood pressure cuff doesn't even need a smartphone. It can go link directly to the cloud. And then you could show them, this is where we'll be monitoring you on the cloud and calling you. And we want you to, here's our brochure. When you take this home, if you have any questions, call this 1-800 number, and a nurse will call you back. So a lot of these programs are robustly introduced through that. NaviHealth has one of the best reputations for doing this right. And you heard about their $6 billion buyout that they had right there during the COVID pandemic time, that they had that deal strike. So these programs work really well. I do think that a lot of times these programs need to make sure they introduce that RN case manager and keep them in the mix, that's discharging the patient from the home, and then keep that health plan in the mix with those case managers at the health plan. If they're a fee for service, then obviously they keep that network of doctors that patient's been visiting in that network.
Doug, I know before we went live, we started talking about doing this a few weeks ago, and you were talking to me about how exciting you were seeing the potential, the opportunity with going, B2C, and really you were talking about the latest acquisition, that even Weight Watchers, and why you were saying that. Why that was so important as a case manager, I remember you saying, is just about in every patient, whether it's diabetes or weight management, it's in their goals. So could you maybe get at how this technology with the acquisition of I'm not even sure what that company is. Tell us a little bit about this and how this
Yeah,
connects with, remote patient monitoring and really that
yeah,
digital health care manager, if you would.
I would love to. And the thing is with this B2C, we got to understand in the background, healthcare in America is still a business. Okay. We're not a social medicine country. Our health plan is paid for through our employers or through the government, but it's still paid to a private company in a lot of cases. And sometimes they're publicly owned, public health companies, or they might be nonprofit companies. But in the essence of it, they're not, they're still businesses. And a lot of these B2C things like Weight Watchers and Fitbit and things like that, and Amazon realize that with COVID, we've seen this introduction where people are going to seek out the care themselves because they don't get the proper care, even though they have an insurance from the government. Maybe it's a Medicare plan or a Medicaid plan or a Medicare Advantage plan or something like that, some type of managed care plan. It's not meeting their needs. And they are seeking to meet those needs through Amazon or through this new program with Weight Watchers. They've been using Fitbit and Whoop bands and Aura rings and things like that at addressing one of their primary concerns, which is weight loss and health maintenance. And so we know that thing, your weight management alone ties into a lot of your medical conditions. If you control your weight, you're going to avoid having a lot of these chronic conditions as you age. And so I think people are starting to become aware of that. And Weight Watchers is spot on with purchasing that telehealth company that will be able to call those patients and prescribe them some weight loss medications and better manage them with medical weight loss control. And people will pay for it.
Mm-hmm.
Same with Fitbit. Fitbit has the most users of any consumer app when it comes to health and fitness.
Doug, I hear this, and another thing I'm hearing out there talking to experts is how competitive it is, the margins in Medicare Advantage, and then the enrollments, trying to get those members engaged. So I see this as a way to differentiate yourself as a plan, and doing that, there's going to be more of that. So I imagine we're going to see in the next few years plans. I mean, we already see it. We see plans that are offering transportation. Some of them are offering, basic housekeeping or house cleaning. And so I would imagine these are just more of the tools and opportunities. Sorry, go ahead.
They're offering food too.
Yeah. So with this being said, what is, in your experience, is like the number one barrier or the challenge of making this happen? Is it regulatory? Is it what is it? Tell me the challenge of really getting digital health transformation and making this digital care manager happen.
I think the number one barrier is awareness and also just hesitancy to change into the unknown. And other industries are willing to take the risk, and they've embraced technology, and they're seeing how technology can make that business more fulfilling, more efficient, faster operating, and streamlined. Where medical, they're hesitant. They're hesitant because of fear, a fear of the unknown. And we know that technology will help fill some of these gaps, yet there's a hesitancy of acceptance on the doctor that really didn't get into healthcare as a business. He got into healthcare as a passion maybe, and wants to just help people. Same with the nurses, but in the back end, it's really a business, and it's a customer service business. So if they don't realize that, we've kind of neglected the whole customer service aspect of healthcare for many years because of supply and demand. We have an overly demanding, for a limited supply of providers that can render this care.
So Doug, if you had to, what do you think is just just in one sentence, what is the problem? Why are we not getting this? Why is this not happening right now?
Well, I think it's like I said, it's moving a mountain of an industry that's been traditional and slow moving for a
Hmm.
long time. And I don't think that, and that industry is basically owned by private health plans. The health plans have more money than our government when it comes to rendering care.
Hmm.
So that that is, if you look at the top three or the top five health plans, the billions of dollars that those health plans have is, way more than what our budget is overall for our health plan budgets for, as we write out our budget every year. So you have to look at that fact that they're the true decision makers
Hmm.
here, even though we,
I like that. So you're basically saying health plans have the power. And when I was talking to someone the other day, we're recruiting for a role, and talking from someone, let's just say, I don't need to mention a name, but he referred to him as, I'm part of the Big 20. I've
yeah.
heard of the Fortune 500, but he referred to himself as a member of the Fortune 20. That was a new one for me. And I don't have to mention the conglomerates that make that up, but that's just tremendous. I mean, they're printing so billions of dollars quarterly. And so I guess we are seeing it though, because that, keeping members well, healthy, and out of the hospital, it's just at that cost point, So I guess there is some innovation, and but it's still slow, right? I mean, it's still uh, you know, still slow to happen.
It's still slow. I mean, we're seeing some of that technology helping some practices, and they're taking advantage and they're doing the CRM type messaging for their patients and trying to get them into the office. They're teaming up with some of these health plans and these shared risk agreements, and so they can borrow their technology. Maybe they all centralize on an agreed upon EHR system, so they can have a better health information exchange system for that patient's care continuum. But that is, we still at the end of the day, it's still, you have to be able to run it like a business and put people in chairs and have those people accessible to those patients. And we just don't have that accessibility. We know technology will improve this accessibility. Right now, we're talking through three forms of social media right now and using technology, and our people are using this technology every single day with their smartphones and with their workplaces. A lot more people are working remotely from home, and so why wouldn't we want to meet that patient where they're at and meet their needs where they're at with introducing some of these remotely monitored programs that can keep them on target, keep them healthy.
So, Doug, I would love for you to just walk us through when a client comes to see you and sort of what you are hearing from them, their challenges, and how you're helping them.
So I get clients from all different spectrums. It might be a tech company that is, wanting to have my clinical advice and my experience advice on managed care, on how they can introduce that SaaS platform or that device and get it branded and marketed and to be utilized by whether it's a health plan or a doctor's practice, or it might be a doctor's practice that is just confused by the mess because they've seen every sales pitch from every type of RPM and telehealth company that wants them to use their product, and it's just confusing to them at that point. And they're saying, why am I paying all this money, and I don't really have any control, or why should I vendor everything out? At the end of the day, I'm still at risk for my patient's care, and will it really help their care? And so I get it from both ends. I have some clients that are CMOs that are kind of have me on as like almost like a mentor in the background because they've taken on a role as a CMO for one of these tech companies, but they're a new graduate, or they've been, just went through medical school, and they didn't experience, the thousands of hours that I've experienced in different practices.
So
And
when you say CMO, you mean Chief Medical Officer, and
yes,
essentially this company, this startup, telehealth, whatever you call it, needs that Chief Medical Officer for credibility, then for maybe doctor's orders, et cetera. And they just did not get that rigor in medical school of, case
none
management.
of us got
Okay.
that.
Okay.
Yeah. None of us that went to, the doctors obviously went to medical school, or even the nurses that went to nursing school. We didn't get that business. We either came into working from our school to our work. And maybe we started off in a big institution where HR and everybody figured everything out. You just show up, and then next thing you know, you're indoctrinated, and everything else in the background is done for you. They don't realize, or if they were lucky, maybe they did their own entrepreneurship. And I've worked with doctors that kind of inherited their practice from their father's practice or their mother's practice.
Doug, when I hear that, it's what I've heard with doctors having so little training in medical school on nutrition, basic nutrition. And so what I would love to hear you share with our audience is, when you worked at health plans, they have all these metrics, the HEDIS, the quality metrics. Can you walk us through just what the value is, just kind of in a real 30,000 foot view, kind of the things that are going on? And then if you could connect that to digital health, because I feel like that could be a big opportunity, because with those metrics, you need data. So tell me how that could, okay.
Absolutely. And that's a good point. So when you're working with a health plan, or what you're working with the MSO, which is contracting the health plan for your provider networks, they have HEDIS, and those HEDIS matrix, or those star matrix scorecards, are based on the codes you get from those encounters with that population that you are being prepaid for. They pay you a set amount every month based on, if it's a senior, it's based on their RAF score or their HCC coding, diagnosis coding, or it's based on just the contract agreement, whether it's usually a shared risk or a full risk type of agreement, and they are paying you a monthly rate. Now, what they're saying is they're only going to pay you a portion of it, but you have to show us the data that you're capturing for all our diabetic patients. You need to show us that you're testing their diabetes, and that their diabetes is being controlled. Not just that they're testing it, but it's being controlled. So if you have all these out of range diabetes, HbA1c data, you have to show that you've done something to reduce that HbA1c. Same with blood pressure, or then even just a preventive screening. Are you doing mammograms on all your females over 40, and all you're doing colonoscopies and making sure that all your patients have colonoscopies over 50? Those type of things those are analyzed. And that started off by Ford Motor Company, just trying to compare the different commercial plans. So that's actually how HEDIS kind of started, as they were looking for the best plan. So they've kept that same theoretical, thought.
So you're telling me, wait, am I hearing you correctly? Are you telling me in Detroit, the Ford Motors, like they needed to manage their workforce, so the HEDIS came from that? Or are you just talking?
That's absolutely, there's an indirect connection to, that's how everything kind of started, was they were trying to evaluate the quality of the commercial plans that they were getting for their employees.
Wow, that's fascinating. And I'm going to go on another tangent, a rabbit hole, because we're on planet first, and we can go to Mars, we can go wherever we want, because this is what this is about. But I remember hearing that Henry Ford, he was a proponent of kind of the work week to a certain amount, selfishly, because if his workers were working so hard, they couldn't have enough time to drive that wonderful little Ford around on the weekend. So that was part of marketing, and then also keeping those cars cheap enough or price point enough that their average worker could afford it. So I think it's fascinating. That's innovation.
Yeah.
Yeah.
Well, they were truly ahead of their time when they thought of rating the quality by seeing how well that workforce is being managed. And if they're being managed properly, that means they're having the doctor's visits, and then that doctor's visits is actually doing something.
Mhm.
And it's keeping them on their medications if they need therapeutic medications. It's keeping their blood levels controlled if they're diabetic. It's also making sure that they are doing all those preventive screenings that we know if you catch something early on with some preventive screening measure, you
Doug,
can deteriorate worse conditions
could you
later.
share with us, do you know about the time frame that Ford began doing this requesting the measure?
I can't remember.
Okay.
I know I loosely learned this as I was forced into these roles to analyze these matrices for
Yeah.
my medical groups and come up with a strategy how we were going to improve quality.
It seems like AI could be really huge on trying to help, but then how do we've seen Chat GTP that's gone berserk, wanting to name itself and tell who it is, and then hacking all the other ones and dominate the world. I guess that was, but so I know there's a lot of hesitancy in making sure that there's systems in place. But tell me a little bit about some technologies as a care manager, as a case manager. How do you evaluate side by side when you're helping these people? What technology is the best suited? Tell me how that process works for our audience.
Well, one of the first technologies that we used that has been around for a long time was IVR. So we would send out recorded messages to our patients and reminding them to come in for their preventive screening. Now, the doctor's offices couldn't do this. They didn't have the technology, nor did they have the budget to do this. So we did this as a health plan, and we put together all our list of all our members, because when you're signed up with a health plan, you're considered their member. You're not considered a patient. And so we would use these IVRs, and then that IVR we had a set list of messages that we sent out. So obviously, we would send out maybe a mammogram message to all the females that we knew were due for mammograms, and gave them some recorded information. And then we took that information back. It would go onto a database so we could follow through and send them an authorization or usually we would just pre-send them an authorization to get that mammogram done. But the IVR was kind of reinforcing, did you receive that in the mail? If not, please call this number so we can make sure we get that scheduled. So we were using that technology 10 years ago before this chat.
So I would say to you, that's kind of what they would call like nudging, like with some of these apps. And
Yeah.
then the problem is, right, you probably started finding out that there was a lot of nudging fatigue and just where you just
Right. There was a lot of nudging. So then we took that IVR because people were no longer answering their phone. And then we put that IVR into text messaging. So then we started text messaging our patients and tried to capture all of their cell phone numbers. And we would text message them different reminders and making sure that we kept them on track for, at the beginning of the year, everybody needs to schedule that annual wellness visit. And we worked with companies that were advancing this. And actually, in the very beginning, a lot of health plans were hesitant to use this new technology. They said, is it violating privacy? They have to give us permission because it could be a charge for a text message and so on and so forth. And so after we deal with all that drama and you find out ways to ask them to click no if they want to opt out of this and all that other stuff, then we started using text messaging, and that worked very well for some of our campaigns. And that was before Salesforce did that whole CRM thing and started bringing it full circle. Then later on, we started getting the emails and started building the websites and helping these building. Of course, as a health plan, we have the money to build the health plan websites, or as an MSO, but that practice is still playing catch up when it comes to the website and to the CRMs and to these different types of methodology. that we can now introduce to them through our technology with our vendors.
Doug, help me understand. I know like the importance that I've heard of motivational interview and really understanding that empathy in order to really make sustainable behavior change. In the end, if someone's not motivated, so when you're doing your goals as a case manager, it's really what is it that individual, you know, when they're getting out of rehab, maybe they tripped, fell, whatever, and if they're motivated to go to their grandchild's graduation, that's their goal or whatever, or walk their child,
right, or their
daughter down the aisle. So,
yeah.
so tell me a little bit about, as a case manager, how you can merge technology that doesn't become too dry, and then the human element to really make things happen where people actually achieve some goals and sustain this healthcare, positive healthcare behavior.
Well, motivational interviewing and motivational management is really at the core of a case manager's role when they work with a health plan, is to learn these motivational efforts. And when we first meet with that patient over the phone, we normally do a goal-oriented care plan. Okay. There may be some other meetings and introductory calls before we get to the care plan, but we will write a care plan out with attainable goals, with step-based goals. And one of the biggest motivational factors is having an accountability partner. People are not motivated to do things if the accountability partner isn't a good match for them. I'm able to use my watch as a good motivator and accountability partner. I will look at the messages that I set up, and it'll send me messages to remind me to take my vitamins, or remind me that I'm not taking enough steps and things like that. But some people need more of a nudge, that they need that personal touch. You're on mute.
Yeah, I have a dog in the background that just
Yeah.
barks at Ghost, I think, or my wife coming home. I don't know. So I was on mute.
At Martians.
Yeah, at Martians. Yeah, since we're at Mars. But where we were at, and now I guess my wife's coming home. But anyway, welcome to Planetary Health Mars Next. So what I was thinking of is that you're huge in mountain biking, and I know that is something for you as a motivating factor. And you're in a group, you're accountable, and it seems like that level of accountability is probably why Silver Sneakers and all these programs are so effective. Can you get into a little bit of that for a few minutes while I can be mute?
Yeah. So I'm glad you mentioned Silver Sneakers. So I was working with Scan Health Plan, and at the same time we knew about some of the other health plans, and CareMore, which later on got purchased by one of the Blues. But CareMore was the one who started the Silver Sneakers program. And CareMore realized that, hey, why not just give these patients or members a free membership to a gym, and not only have a free membership, but have some coaches and have the case managers become almost like nurse coaches to them, and focus more on the fitness aspects and the activity and monitoring your steps. So they actually mailed out the early pedometers that we don't even have it now. And they were these little, just a little pedometer that you clip to your waistband, or if you wanted to clip to your tennis shoe, you could do that, but it didn't matter. It could be anywhere. And they would actually talk with the patients about how many steps they're doing a day, or if they went to the gym. And that worked out really, really well. And there's some really great studies that they did on just that simple fact alone of getting these people to be active.
Yeah, I really like that. I feel like that is the hallmark. That is the gold standard of a way to see the power of even in AA, having that sponsor. It seems like that accountability partner. And I would love for you to kind of share a little more, like how we could take a digital health care manager, AI it, humanize it, and make it accountable. Like, what would be the Doug Sullivan program if you could be at health plan XYZ and start the new program. Tell me what that would look like to you.
Well, thank you. I'm not at a health plan right now in that type of role. I'm in kind of behind the scenes in an advisory role for a CMO right now. Actually, two different CMOs with different businesses. One's at a health plan. One's at a big company that does CGMs and does it for diabetic patients. So the thing is, if I created this perfect plan, I think part of it is in the marketing, and we don't have people think of their health plan as a benefit or as a value. It's not like a brand new Mercedes sitting in their driveway that they just bought. That it's not that it doesn't appeal to them that way. But why can't we brand it that way? Why can't we brand it? Aren't you glad you have it? And one of the companies here in California that's done a great job about that is Kaiser, and they have the highest loyalty of any health plan in the United States for longevity of people staying with that health plan. The thing is, if we branded it that way and people saw the value, because in the very beginning year, they know they're going to get a phone call, and that in that phone call, people are going to talk about, hey, let's tell you about your exciting benefits you get with this plan. We're going to get you a new pair of glasses. And when you get your glasses, make sure they do a diabetic retinal eye exam, because we want to talk to you, make sure that your retina's, not, closing, and you're not having problems with diabetes. And we offer that as a benefit. We've extended our offer for more physical therapy for you, because we realize as you age, you're going to have more musculoskeletal problems. So we've expanded our network of physical therapists in your area. Matter of fact, we have physical therapists that can go to your home, talking to them about all these types of benefits. And then the technology. Are you using a computer at home, or are you using an email, or are you using a smartwatch? Well, we have plans. Part of our benefits will tie into this and send you reminders and send you emails, and you can participate in webinars with us about health and nutrition, about, good recipes to cook at home. Matter of fact, I worked with a person that was the owner's daughter of a health plan that's her thing, was sending out nutrition recipes to the members, because she, kind of inherited this plan from her parents, but she wanted to really focus on the recipes and helping patients. So she wrote a newsletter and sent it to every one of her patients. But that type of intuitive that goes into the same type of branding we do with other businesses needs to go into health plans.
I love that. I'm hearing social determinants of health. I'm hearing risk assessment. I'm hearing assessment, but not only am I hearing assessment, I'm hearing a dynamic, real, personalized, two-way, conversational, meeting that member, not only where they are, where they're going, and back and forth, how to get them fully, holistic health. It makes me excited. I mean, but when I think of health, my health plan, I'm thinking, oh gosh, I don't want to get that x-ray, because I know it's going to, I'm going to have to pay for it. I mean, that's unfortunately most of how healthcare is. I know Medicare Advantage have done a lot different, because of that. They're trying to get you to sign up for all those other plans, if they can get you to sign up for that one plan over the other plan. So I think that competition does well, but I loved how you're leading the discussion on all the different, the diet, the food, the recipes, the glasses in the beginning. So what do you think you would, I would love for you to share a little bit how you could help someone in the audience, kind of what you do, whether it be for a provider, as a consultant. Just share a little bit what you do and what you really like helping, when you're doing your consulting.
Well, first of all, I'm not a single shingle. I have a team. We have physicians and nurses and tech people, coders, full stack coders on our team that help transition this practice into the new age, or help this tech company transition into the practice. So we catch it at both ends, and we want to build these robust programs with our experience. We were early adopters with RPM programs, And we had the advantage of being able to test people daily, every day, twice a day for several years, even before COVID started. And so with that experience, we learned a lot about the struggles that it takes to enroll a new patient or enroll a new practice, or get all your people assembled into a workflow pattern that is really conducive to expanding the program and making that program work effectively for each person as an individual. And so that's where we help. We want to make sure that that company that reaches out to us, or that person that reaches out to us, can take advantage of our experience, and then we can help them have a winning solution for whatever problem that they seem to need to address. Part of it is having that acceptance by the practice, or that acceptance by the patients. But the other part may be something more 30,000 foot look level, with the compliance guidelines, with Stark law and things like that. We're not lawyers, but we do hire lawyers for practices, and we can recommend lawyers that they do. But we do have we use the same type of contracts and same type of clinical programs that I've used for the past 25 years working as a case manager for the health plans. So that alone, most doctors don't even realize all this case management programs and all these things that had been done for many, many years, and how they were doing, how those things could have been done, because they didn't know about them.
This is great. So I'm going to, one more time, as if they couldn't see it, Doug, tell us how people can get in touch with you.
Well, thank you for putting my email. The email is the best way to keep in touch with me, because I do have a very busy day, and I don't have time to look at emails throughout the day. But if you email me, we could set up a quick call with me and a few members of my team to assess your needs. We always offer a courtesy 30-minute consultation before we plan out and set up a contract with you. And it's really up to you where we want to meet you. Just like we want to meet the patient where they're at, we want to meet our client where they're at.
Awesome. Thank you. Thank you, Doug, for this. And we're going to be wrapping it up soon. It seems like right now around 40 minutes is that sweet spot. An hour just gets too stale. It's like a coffee. You want to have coffee on a first date. You don't want to go out for dinner, I think. You know. So anyway, I'm really glad, Doug, that you said yes. And I really appreciate you coming here today. And I love your background. I mean, I have this funny background with the earth in the background, but you got a classic grand piano. It looks great. Oh. So anyway, what I would say to the audience is we are excited here at Planetary Health First, Mars Next, really having dynamic discussions, robust discussions on healthcare. And today we had Doug share with us everything it means to be, moving healthcare along with digital health, using all those key metrics, those protocols that are required by the health plans that are literally, right, CMS. It's the federal government that's mandating that, correct? Tell us a little bit about that as we wrap up, Doug.
CMS mandating the improvement?
I guess most of these metrics that are guiding the HEDIS, isn't that part?
Yeah, CMS is requiring this, and it makes a huge difference, because if a plan is at a 3-star rating as opposed to a 4-star rating or a 5-star rating, it's a huge jump in reimbursement rate that they get from CMS for those patients that they're managing. And so it's such a significant amount that every year plans spend millions and millions of dollars to do this data dive and to capture the information from the EHRs. I work a lot of contract jobs where I'm just reviewing records and searching for that data, and so we can capture that data for those patients that are in that denominator, because it's and so we and many nurses like that. So I wanted to kind of parlay that into teaching nurses and teaching providers about this type of stuff. I talk every Friday on Clubhouse in a room that we created called Nurses to Tech. And that's actually where we met. You and I, Michael, was on Clubhouse. And so there's so much opportunity for that nurse and that doctor that might be burnout from that bedside care, but they really want to keep that license active and they really want to help patients. That was their passion. That was a reasoning for choosing that career path. And now there is more opportunity in this work from home or consultation or different format where they might have to go to an office if they're a CMO or if they're that branding expert for that product, but they still can have these alternative careers still utilizing their clinical background. And so that's a lot of what we talk about. And HEDIS is just one way where there's been a massive amount of nurses that are rekindling their passion towards seeing other things that can be done for patients in that retrospective review, looking at that HEDIS data.
Doug, I love how you touched so many different things today, and different audiences, just for those doctors to know that they could connect more with you on telehealth and doing consultations and that Clubhouse show. And just the other thing, we're wrapping it up. I want to let everyone know we have this video resume component. So we know things have gotten really rocky out there in the career market, especially with SVB, with the collapse of a lot of, the financial, and with a lot of these tech startups, unfortunately. So we always are looking for people to just share a few minutes of their video, and we would post it on the show. We'd post it live. I'd post it on my LinkedIn post, which is your video resume, sharing who you are, what you're about, what you can do, what you're excited, what you will do, maybe that organization you'd like to work, what you are currently doing. And it's just a great way to get exposure, share your story. There's like nothing more than getting someone's personality on a video, and your energy just isn't captured by a resume itself. So we are going to wrap it up. Until next time, my friends. Next Thursday, we'll be live again on Planetary Health First, and you'll be able to see more about Doug on the wrap up. We'll have some information next week on our newsletter where you can reach him. He'll share a little more about him and what he's doing. So everyone, have a wonderful day, and thank you so much for joining us. And thank you, Doug.
Thank you, Michael, and thanks everyone in the audience for joining us. We look forward to your questions. And since this is a live recording, the comments will go to us, and so we can respond to the comments. And that's another great way. If you weren't able to comment during the live video, you can always comment afterwards.
Awesome. Thanks, Doug.
All right. See ya.